watching We Heart Therapy, the special series EFT Talk. I'm your host, Dr. Anabelle Bugatti, licensed marriage and family therapist and certified EFT supervisor and therapist here in fabulous Las Vegas. And we are excited to welcome to our show Dr. Paul Greenman. He's a licensed psychologist in Canada. He is the chair of the Department of Psychology for the University of Quebec in Ottawa. And he's been part of the Healing Hearts program that is in its kind of early stages. He's also engaged in a lot of research, outcome studies for EFT. He's done some tremendous work for us. He also incorporates EFT into his teachings at the University of Quebec. And he's an EFT trainer. And he does a lot of EFT trainings over in Europe, in Munich, and he speaks several languages, which is fabulous. And if many of you guys might remember, you've seen an article that's been published in the past. Of course, it's all about attachment with Sue Johnson and Dr. Paul Greenman. So this is that Dr. Paul Greenman. So we're excited to have you here, especially for those of us in the States who don't get much face time with you. Thank you so much for being with us.
I'm happy to be here. Thanks for having me.
Excellent. So today we're going to be talking about how chronic illness, how chronic pain, how any kind of major health issues really impact couples, because we do have a lot of couples where this comes up. Absolutely. And we're going to talk about how EFT can really, what we can do with EFT to help these couples in distress.
Sure.
So can you help us understand a little bit more about maybe the particular challenges that these couples might face that might be a little bit different than regular couples that don't have chronic illness?
Right. Well, with most chronic diseases, especially the big ones, though, the ones that really scare people, right? When we hear about cancer or heart disease, so if someone has a heart attack, other chronic illnesses like diabetes, these are all very dangerous conditions, right? And as an EFT therapist, we always have attachment theory in mind. And one of the basic tenets of attachment theory is that situations of stress will create or encourage attachment behavior. They'll sort of fire the attachment needs, so to speak. They'll trigger these attachment responses. And one of the things that happens with chronic illness is that's a really stressful situation. So the person who has the illness, again, from an attachment perspective, is very likely going to be afraid, very likely going to feel confused. And it always does depend on what some of the life circumstances and health circumstances of the person were before they become ill. But the attachment system gets activated. And the same is true for the partner, right? Even if things were going well in the couple before and they had a secure bond and they really felt the emotional availability of the other person, I've had a number of clients through the years who after the heart attack, they say, oh, well, then everything changed. And everything changed in our relationship because now the person who has the illness is dealing with all of this fear that comes up and all of this uncertainty. And is trying to navigate that. Very often thinks, though, I don't want to burden my partner with this, or so I'm, not going to talk about it necessarily, or maybe it just hurts me too much to think, I can't work anymore, or that I might be dying. And then that can trigger a very strong fear response in the partner, because what's the greatest fear, really? It's the fear of loss of a main attachment figure, right? Mm-hmm. So these attachment fears and needs really do get activated within the context of chronic illness. And then we see patterns evolve that are very similar to the patterns you would see in couples who aren't necessarily facing illness, but it tends to really center on themes that have to do with the illness. So one person, and I have the examples of heart disease in mind, one person might now take a position of being really nagging and, oh, you're not going to eat that, or what, another glass of wine? And oh, well, the doctor said I could have one. And he didn't say you could have one that big. And we see these sort of pursue withdraw dynamics that get triggered. The central theme tends to be the illness, but the attachment drama that unfolds really is about the same kind of attachment dramas we see in couples who aren't necessarily facing chronic illness.
Right. So you said a lot of really important things. So let me make sure that I'm getting all of this correctly. So what I hear you saying is that basically a lot of these illnesses can trigger basically an existential crisis,
Yes.
not only for the individual, but for the couple. And of course, you know, both of them become afraid of that potential loss that could happen. And it also can trigger a lot of view of self pieces that come with the existential. And, you know, something that you said that really was important, you know, about how this illness might center around the cycle, be the focal point of the cycle a lot more than couples that don't have this. Something that comes up for me too is the limitations that might come with some of these new illnesses, right? Like somebody who's diagnosed with, you know, a disease that, you know, debilitates their movement and they can no longer move the same way, you know. I can't, for some reason, I'm having brain fog around the actual.
Mobility is a big one. Mobility is a huge one for certain types of chronic illnesses. I have a particular expertise with patients who have heart disease, and that's something we see all the time. The changes that the illness forces on the person. And as you mentioned, yes, then there are all kinds of questions about oneself. You know, I used to be able to work. Now I can't work anymore. I can't provide anymore. I'm not contributing anything. And these are things that, you know, in addition to problems in a relationship, levels of depression, levels of anxiety, and even cases of post-traumatic stress disorder are very high in certain populations of people with chronic illnesses, especially heart disease.
I've seen a lot.
Go ahead.
I was going to say a lot of that come up also around like fibromyalgia or multiple sclerosis, where these are things that slowly debilitate the body over time. And there's a lot of shame issues. Like it's not only I can't work, but now I can't tie my shoes. I can't bend over and pick up simple things, like I can't care for myself. And now I need to rely on my partner all the time. And there's a lot of shame, and it can spark a lot of withdraw and avoidance. Like I don't want to ask for help because I feel so much shame, and I don't want to burden my partner that now they kind of have to treat me. I've heard clients say like an infant, you know, is what they start to feel.
And then the partner who's facing all of this that you mentioned can start to feel distant and unimportant. And that's the kind of dynamic that we often see when working with couples who are facing chronic illness. It's sort of, you know, I know something's up, but you're not telling me about it. And I don't dare bring it up with you, but we're both feeling it. And I get angry at you, and then you pull away from me more. I mean, that's one of the typical patterns we see. I should mention, I didn't mention this yet, but a variety of chronic illnesses also affect sexuality, which can be another taboo subject for people that they don't feel comfortable talking about with their doctors, or sometimes even with each other. Or sometimes, again, I think in the case of heart disease, people tend to avoid sexual activity because they're afraid that it might provoke another incident, even though we know that sexual activity in and of itself isn't inherently dangerous, even for people with heart disease. But these are, you talked about changes, and I think that's the key element, right? Is these illnesses, they force upon people and then on the relationship a lot of change, a lot of adjustments. I mean, I'm looking out the window here, and there's about 2 feet of snow on the ground, and here the big one is, oh, I can't shovel anymore, right? Or but as you said, it can be something as simple as, especially if the illness progresses, I can't even tie my shoes. I can't even take care of my personal hygiene the way I used to. And then the shame that's around that. And all of this happens within an attachment context, right? So people will behave according to what they know. You often hear people talk about attachment styles. I prefer to think of it as sort of their usual way of
Managing.
Entering into or managing their relationships, right? And some people will talk about it, or some partners will take the risk of saying, hey, you know, I miss you. Since the heart attack, you've been really distant, or since the cancer diagnosis, you've been really distant. What's going on? And they will be able to broach all of this pain and shame and do it in a way that helps them feel close. Unfortunately, a lot of the time, that's not what happens at all. And then you see a lot of pursue withdraw, sort of the partner who's not ill, really out of love and out of fear, right? It's attachment fear of the purest kind. Medicines, doctor's appointments, he said this, you're supposed to exercise, you're not supposed to do this, and I'm not going to, you know, you're not going to be eating that. But also sometimes what you see is a withdraw sort of thing. Right, where nobody, and there's the elephant in the room and everybody's dancing around the elephant, but nobody's talking about heart disease or cancer or diabetes and what it's done to the person who has it and what it's done to the relationship.
Right. And often I love, you know, you talked about the pursue and withdraw cycle. And I think, you know, also what I've heard kind of on the pursue side is, and they feel there's some guilt over their feelings, but, and you mentioned, you know, changes is the essential part, is that sometimes the pursuing partner kind of feels that loss of a partnership because maybe the relationships had to shift to a caretaking kind of dynamic depending on the illness, or they feel like they're the caretaker and they've lost that partner because maybe for them they don't experience their partners taking all the steps that they could do for themselves to take care of their illness. They're not taking their medication, they're not eating correctly. So, you know, you mentioned the nag, they feel like I'm nagging and I don't feel like I have a partner now that they care about staying around long enough to, you know, live out our happy life together. And, you know, so it really shift that dynamic.
It's interesting you talk about caretaking. I had one couple, and actually this case was written up in an article I wrote with Sue a few years ago called United We Stand. And in it, it was a case where the male partner had a heart attack and then had several stents. And the couple, we were doing a study at the time on EFT and couples facing heart disease, and they signed up. In the very beginning, the female partner in this relationship was really just furious. And she would say things like, this man is actively trying to kill himself. He came back from the doctor's office. You know what he did? Do you know what he did? He went and bought a bag of peanuts and a bottle of whiskey, right? And it was that kind of intensity. And what is that to an EFT therapist, right? That's attachment fear. That's all attachment fear. That's all about, I love you. You are my partner, my lifeline, my anchor in life. And anything that is threatening that is going to make me really scared. But what she, for a number of reasons, many of which had to do with her own personal history, you know, making herself vulnerable and talking about that in a vulnerable way, what didn't come naturally to her at that point in time. And then, of course, the male partner, the one who had the diagnosis, who had the heart attack, would become very, very defensive. And as in a typical cycle, sometimes the ball would get rolling because he was really emotionally distant. Other times, maybe she came home and saw him, you know, maybe having a whiskey or something and would get really angry. Either way, they both got sucked into it. And the work with couples like that, just like in couples who are facing other things, it's just that with chronic illness, it has so much to do with the disease and what the disease has done to the bond. She was able, through EFT, to learn how to say to him, you know, when I just see you, even having one peanut, or if I just see the bottle of whiskey on the table, I know you're not going to drink half of it or all of it, but for me, even just, you know, seeing you take one sip, for me, that's the same thing as if, you know, you took a gun and you were pointing it at your head, and that's how scared I get when I see that. Well, that then enabled us to have a different kind of conversation about what was going on. Getting people to share that how lonely they feel, how frightened they feel.
Yeah, and I love what you're saying too, right there. You know, with the way that this, so it's like the health issues become a lot of triggers and cues, and this thing with, you know, you got peanuts and a bottle of whiskey. You know, it's like, I want to know that you're also fighting for us. You know, to be
and
with.
She was furious that he wasn't. that he didn't care about the relationship, that he didn't care about her enough to, and once she was more vulnerable about it, then we were able to, that sort of set the stage. He had already done some exploring of what it was like for him to have heart disease, but once he was able to get those more vulnerable cues from his partner, he was able then to go more comfortably than he had into his own fear and uncertainty and shame. That was a big part of it for him. This disease had forced a retirement, an early retirement, and so on. It just fascinates me how you mentioned that article. It's all about attachment, all of it. It all comes back to that in chronic illness in the most fundamental way. I mean, death is in the room.
Mm-hmm. And death is a part of our survival system, and so is attachment. Yeah. And so to have those two come together is like a double whammy for a relationship, you know, the death of an attachment partner.
Yeah.
And, you know, there's another aspect of chronic illness that, you know, I also want to bring out too is chronic pain. This is something that I've seen that has been even tougher for couples because sometimes this pain is just managed with the pain management system, but it's, you know, the pain never really goes away and there's nothing that can really be done unless it's surgery that could make things worse. So it's like couples that live with chronic pain and then, you know, it's hard for them to let themselves engage or feel sexual or relax because of the pain. You find their partner afraid to pursue because they feel guilty. My partner's in pain. And so you start to see how this pain can become front and center in the relationship. And it's hard for the couple to feel like they can connect, but it's a very real, tangible thing.
Yes. Yeah. I don't have as much experience with chronic pain, but in the patients I have seen with chronic pain over the years, it is like what you're saying. It just takes up all the room. It's like there's no room for anything else. It's constantly there. And in some ways it's difficult because one of the common interventions for dealing with chronic pain, very popular, is distraction, right? In a very simplistic term. I mean, you get people to focus on what they're doing in the moment. You get them to get their mind off the pain so they can at least temporarily enjoy whether it's, the company of some other person or a book or a song or whatever it might be. The problem I always had with that and with that way of working with it is that then when you do bring it into a relational context, well, are we encouraging people to continue this avoidance, this sort of not talking about it, this sort of distracting themselves from it, when what we would want to do in EFT context would be open up about the pain, open up about how you feel like it's ruined your life, how you feel just this constant gut-wrenching, excruciating pain, name it, and then maybe we can help the partner, if they need our help, really respond to that. And often, as you've probably noticed, what happens then is once it's been named and the partner feels like, okay, now I'm on board too, well, then we're facing this pain or diabetes or heart disease or cancer. We're facing it together. Yeah. And it really is true, the powerful effect that can have on couples, on people, just feeling like, okay, there's someone here with me who's facing this with me, and I don't have to deal with this by myself. I might be the one who's in pain, or I'm the one who had the heart attack, but we're in this together. It's hard.
It is. And I love what you're saying is, instead of, EFT will help us be able to map this and navigate how this shows up in their, EFT dance or their cycle, but also helping them be able to turn towards each other and be a source of comfort and soothing and strength, especially in the midst of pain and something so scary that we feel like we're in it together. And I love what you said about distraction, but, in those, sometimes people will turn away from their partner for their distraction, like something else, and they don't, and they start missing that connection time. And I have a few clients with some chronic pain. One of them actually told their partner, when we connect, that's the best distraction from the pain for me. Like, when we have sex, right? I sometimes the pain is low enough that I can, and then when we have sex, the pain goes away for a few minutes, and it's this little bit of time that I have an escape from pain.
The respite. Yeah.
Yeah. But without being able to talk about it, their partner would have never known.
No. And people are left wondering, they're left guessing, they're left with uncertainty, all the things that we know to be toxic to a relationship, a happy relationship anyway.
Yeah. And the interesting thing is when we read, some research by Jim Cohen, hand-holding studies and stuff, what they found is that connection, actually can release pain-blocking chemicals in the body. So, connection can literally be your Motrin, It may not be powerful enough to take it all away, but...
natural opioids, and it goes beyond distraction, right? At that point, we're not only taking someone's mind off of it, but we're actively doing something to combat the pain. And the pain, physical pain, emotional pain, brain doesn't distinguish between the two. And if you're helping someone feel more connected to a significant other person, as you're saying, that helps deal with all kinds of pain, not just emotional pain.
Yeah.
Physical pain as well.
So what would you recommend? I find that a lot of therapists feel kind of lost when it comes to dealing with pain or chronic illness in relationships. And I think because it's something that we don't always have control over, something that we can't necessarily make go away. So what would you recommend for therapists as their starting point when this comes up, or the couple that comes in with this?
Sure, and it's an excellent question, and it's so important. And if we don't spend enough time on the fundamentals and we get ahead of ourselves, we might miss something really important. What I always tell my students, that the students I supervise in psychology, practicum students or interns in psychology, within a health psychology context, the first thing I say, but as you're getting to know this person, what does it mean for this individual person to have this illness at this particular point in their life? Because it's such a personal thing, right? A younger person who is diagnosed with
Cancer,
heart disease or cancer, it's different than someone who's older, someone who's worked. It's such a personal thing. I mean, there are patterns that we see among people, but it's really important before anything else to really understand what does it mean for this person to have this illness, because it can be a trigger of all of the things that you've mentioned: the shame, the anxiety, in many cases, post-traumatic stress responses, right, to the illness, or to the way the diagnosis was communicated, or to the way the illness happened, right? So what does it mean for this person to have this illness at this particular point in his life, in her life? So that's one very important thing. And then within a couple's context, and how is that then affecting the relationship dance that was already there? Has it changed it? Has it made it worse? Maybe there were signs of pursue withdraw, but it wasn't so bad, and the couple got along well and felt pretty close. But then the illness happened, and it became, a full-blown pursue withdraw pattern with one person just cringing and recoiling, and the other one criticizing and complaining. Is it a complete change, right? Is this a couple that really did feel close and connected and on the same page, and now this has just triggered so much for each of them that they're withdraw, not speaking at all? Are they both frustrated and angry and unsure and doing an attack sort of thing? So we need to understand the effect of the illness on the couple. But in order to do that, I believe that it's important to start with, and how is heart disease affecting this patient who has it, or cancer, or diabetes, or chronic pain? But also, when I meet with couples for the first time, once I get that piece, then I look to the partner and I say, and how is heart disease affecting you? How has diabetes been affecting you? What's it been like for you? Because we know that this doesn't happen, this doesn't unfold in a vacuum.
Yeah.
So that would be the first step, is to really see what it means for the person, then to see how the partner is responding to the illness and to what the illness means for the person. And then it really is a matter of conducting an assessment to really see, okay, do they have a typical pattern, as the vast majority of couples do, right? What's their particular dance? But it always has, I found, with couples facing chronic illness, there's always a health flavor to it. There's always that's a real huge trigger of the most basic attachment fears and longings and all the behaviors that come with that.
Yeah. So what it sounds like, I think I hear you saying, is really kind of up front and center. We want to have a conversation about the meaning making, that the way that what this means to each person. And I love, that was such a beautiful question about turning to the partner and saying, and how has heart disease or cancer affected you? Wow, that is so powerful. That is really powerful. And really, yeah.
Very few of the health professionals will do, just because this is only starting to get on the radar, right? That how important it is for the relationship, how relationships can be affected by this, how relationships can actually be a real tool for emotional and physical healing. This is all relatively recent in terms of making its way into the medical mainstream.
Yeah, yeah. So these are very important conversations to have, and it's very good for us to know. And I love that you're saying the medical profession is just barely starting to catch on. So hopefully we'll have more awareness about this. But so, the first step would be to have this conversation about meaning and how this has impacted both of them, the meaning that they make of it. And then it sounds almost like kind of treating it as the content, and you use that to map out and assess the cycle. And exactly. Almost kind of similar to like any other type of big event that might trigger to come into therapy, like an affair or something, but it's not necessarily going to be an attachment injury, but you're going to want to understand like the before and after. How's the cycle change?
Exactly. And not almost, it is exactly that same process. And that's the beautiful thing about EFT, right? Is that this map and this way of understanding relationships does apply to a variety of different contexts. Just that the major trigger in these cases very often tends to be the illness. And kind of like when you're working with trauma, it is important to do a little bit of education or information giving about what the particular illness is. You don't have to be an expert in heart disease to say, well, exercise is important, or it's important if you're feeling unsure about what's appropriate for you to talk to your physician about that. Or it is important the same way that when we're doing EFT with couples who are facing trauma, where we name it and we say that's a traumatic reaction and that's the trauma descending on the relationship. Well, it's important to do that too, and to share the information that we have, or to guide clients to where information about the particular disease and its repercussions, where they can find that. That also is part of it. But other than that, EFT is EFT, right? We're doing the tango. We're bringing clients through the steps and stages in order to, the overarching goal is to come together, to feel emotionally connected, and in this case, to be able to use that to face this challenge together because of the benefits it brings both to the patient and to the partner.
Yeah, to help them come together, to be able to bond, to find a way to bond together and be better together through this.
Yeah.
And one of the benefits, it sounds like, you know, when people kind of shut down and they start making meaning even about illness and they're coping with it individually, they don't really have this shared narrative about, you know, what this is like for us to go through this together. And we really want to bring them together in that.
And that's one of the things that we do very recently. My colleagues at the University of Ottawa Heart Institute, Heather Tulloch, has spearheaded this project. I've been there with her for the past 5 years or so. Sue Johnson has also been on board. Our colleague at the Institute, Natasha Demidenko, we've developed a program for patients with heart disease based on the principles of EFT, based on attachment theory. And what it is, it's really an adaptation of the Hold Me Tight groups that I'm sure you're familiar with, but tailored toward couples in which one or both partners has heart disease, different types, any type of heart disease. And one of the main components of that, what you were just mentioning there made me think of this, is at the very beginning of the group process, mapping out how this has affected us and sitting down and really looking at what changes has this brought into our lives as a unit, as a couple, as a relationship. And for many couples, this type of group or this type of intervention is really the first time that they're getting the chance to really do that. They might, because of all of the appointments and medications and commitments that they might have, people don't always sit and really take stock. And as you're saying, that's something that's really important to do, and to do it not just as a person, but how has this been for us?
Yeah. And what's important about that too is during that process, I've heard so often they interface with a gaggle of doctors, and a lot of them, their bedside manner is not very,
very. Went there. I wasn't going to go there, but but you went there. Yes, you know, I can only, and I know how it is in Canada, where just the system is so taxed, and even the best meaning of physicians don't have the time to really sit and map out, okay, what has, you know, been the existential meaning of all of this. But it is important that medical professionals have a basic capacity to empathize and to really put themselves in the place of the patient. And that's happening more and more in medical training, I have to say. Like when I train residents in family medicine, for example, that's one of the basic requirements. So you call it bedside manner, but it's patient-oriented and patient-centered interviewing and work is becoming more and more the norm in medicine. And I think that's so important, because
when you
mention shaming, that can often happen in the doctor's office, right?
Yeah. Or the PTSD you mentioned before, the way a diagnosis is delivered. You know, when someone's handing down a possible death sentence, you know, or what feels like a death sentence, that's very traumatic. And to have the doctor not even see how major this is for the person and just kind of matter of fact. And we know that doctors, you know, for their own survival, have learned to shut down a lot of their emotions, and, you know, empathy can go out with that. So it's really difficult, but, you know, just being able to help them empathize and be with the patients as they're giving this life-altering information is so important.
Yeah, absolutely.
So you do the Healing Hearts program. So for those of you who aren't very familiar, to our viewers, can you talk a little bit more about what that program is?
Sure. Again, it's based heavily on Hold Me Tight, and Sue Johnson has been on board with us, really helping us tweak Hold Me Tight to be even more appropriate and more geared toward couples who are facing heart disease. So similar to Hold Me Tight, it's 8 two-hour sessions, and we look at demon dialogues and the traps that couples fall into. There's a session, just like in Hold Me Tight, on forgiving injuries, sexuality. The key differences between this program and the Hold Me Tight program, the key difference is really the emphasis that's placed on heart disease. For example, there's one session of this where the entire 2-hour session involves first having the patients with heart disease sort of go in one room with one of the facilitators, and then their partners be in another room with another one of the facilitators, and then people are talking about the themes that you and I have just been discussing. So what's this been like for you to have this illness? What's your biggest fear been? How do you find that, if at all, that it's affected your relationship? So we ask the partners and the patients this separately, and then we come back together in the larger group, and then the general themes get shared in order to spark a conversation. There's always a didactic component. So at the very beginning of each Healing Hearts Together session, there's a review of the homework for the previous session, then a didactic piece either about attachment or what can create attachment injuries, how to come out of attachment injuries, how to be accessible, responsive, and engaged. What are the typical changes imposed on a person and on a relationship by heart disease? So there's a didactic component, and then the couples work in dyads, and the group facilitators will float. Depending on how many groups there are, you might have more than 2 facilitators there working the Healing Hearts, getting them to engage in the in-class exercises, which, just like in Homemade Site, generally come back to being able to identify one's own emotions, what one does when one has these emotions, and then how that affects the dynamics of the couple. And in Healing Hearts Together, all of that then is under the umbrella of heart disease and how heart disease can affect the individual, the partner, and then, by extension, the dance that they do together.
Yeah, this is really exciting, really exciting. So you guys
Really
are doing
is.
in Ottawa? Is that where you guys are conducting the study?
Yeah, we conducted a pilot study at the University of Ottawa Heart Institute. Heather Tulloch and her colleagues there, and I and Sue, a few years ago, and we got very promising preliminary results. So now we are involved in a randomized controlled trial of this Healing Hearts Together relationship education group for patients with heart disease and their spouses. It's happening at the University of Ottawa Heart Institute in Canada. In this particular study, we will be having a control condition. So we'll be looking at the potential effect of the Healing Hearts Together program on things like anxiety, depression, but also on health in the long term. Things like heart rate variability and blood pressure and cholesterol, because the hypothesis is that when you improve someone's relationship, you're also improving their health. And so that's one of the things that we're really also having a look at here in this particular study, with a more a more rigorous design. And we were very fortunate to receive a grant from the Canadian government for this, from the Canadian Institutes of Health Research. We also received one from the Heart and Stroke Foundation of Canada to be able to do this. We did have to decline that one because we couldn't take them both for the same project. But the reason I smile about that is because 10 years ago, this kind of research, a research proposal submitted to one of these medical foundations would have been laughed off the table. Mm-hmm. And now the establishment is waking up to something that all our grandmothers knew, right? And what we've known in the clinical literature for over 40 years, and that is that the quality of the relationship, and by that we mean the quality of the emotional connection, has a direct, indirect, and direct effect on people's health. Not just their quality of life, which in and of itself is extremely important. I mean, if you're going to be keeping people alive, you want to keep them alive for something. You want them to live for something. So quality of life is a noble goal in and of itself, but it goes beyond that. And it's just so, you use the word exciting. It's so exciting to see that, decision makers are starting to wake up to the importance of all of this and to fund this kind of work so that we can then take this type of program and spread it around.
Yeah. This sounds really beautiful, really exciting. Now, this is a study that's currently in progress and ongoing?
Yes. Yeah, we are recruiting now.
Excellent, excellent. So, you've just...
I just want to say the Healing Hearts program is already available It's available through the ICEPT website. It's designed similar to Hold Me Tight to be, a competent health professional would be able to lead, implement the Healing Hearts Together groups. That is already available. What's ongoing now is the first major randomized controlled trial of the efficacy of the program.
Excellent. Excellent. This is really exciting. And I think, if anyone's like me, we're all excited to hear the results of the study. So, we're definitely going to be keeping an eye out for that. That's going to be, really amazing. And you're really doing wonderful things with EFT up there. Gosh, to help patients. And, it's just amazing. And I love, like you said, that they're finally waking up and realizing, yeah, there's something to this. They're taking it seriously now. So that's good for us, good for EFT.
Good for everyone.
Yeah, good for everyone. Absolutely. So, Paul, you've been tremendous. And for those, I know, some folks in Europe might be a little more familiar with who you are, but for those who are in the States, how do they find you? How do they attend a training that you are at?
Sure. Well, the EFT trainings that I'll be doing in English, I don't do them that often. That's just the way things worked out. My niche has been more here in French Canada and then overseas, but I will be doing with Marlene Best the EFT Externship in Ottawa in November 2020. So that'll be taking place in Ottawa, Ontario in English. And then my other engagements are, the next ones coming up are in Berlin. In 2020, I'll be doing core skills there at a foundation that's called EZI, which is an abbreviation for evangelical. It's not it's a religious organization, but part of their mandate is providing effective couple therapy to people for free. So they've asked me to come and train their therapists there.
Wonderful. So do you have a website, or, aside from the ICEPT website?
Yeah, the best way to reach me directly is my university email, paul.greenman@uqo.ca. And then at the university website, I have a web page with information about me and my research interests and training and that sort of thing.
And I imagine folks can Google you as well.
Yeah.
Paul Greenman. And I'll put your email address in the description for this video and along with your website so that folks can find you.
And I work at the Ottawa Couple and Family Institute. I do private practice there. Sue's been our director since the very beginning of the Institute in 1999. Yeah.
That's really exciting. That's really exciting. Well, thank you so much for being with us today and imparting your wisdom on this really exciting topic.
Thank you for having me.
Excellent. And thank you so much to our viewers. Thank you for staying tuned, for making our videos a success. And make sure that if you haven't already, hit subscribe because more videos are on the way.